work that you need to do with a child to connect with them, recognize the subtle things that the individual differences about them, the way that they need to be helped. This child needs to be helped with very direct instructions and visuals, and this child needs to be helped by mirroring what you are doing, right? This child needs to be helped by some more hand over hand, and you only know that individual difference because you're there with them in the moment and you're connecting with them and you're recognizing it. You can't do that with AI.
Right.
And maybe I'm naive because I don't understand enough about AI, and who knows what's going to happen in the future with AI, but it just doesn't seem to be possible. When you're looking at a child and the way that they're doing things with their body, you're giving them a new body mechanic, way of doing things, or you're giving them solutions, or even, I was talking about therapeutic use of self. Like, I was working with a child today who was very hyper, and she was all over the place. She was running in and out of the treatment room when it wasn't her turn, and I was showing her therapist how to do a good sensory diet with her, and we ended with some deep pressure massage, and it wasn't just the massage. As my tone of voice changed, right? And I started to talk to her about a little girl that had the same name as her as we're doing the massage and what she was doing that day.
Today's guest is someone who brings a wealth of knowledge, real-world experience, and heart of everything she does. Fraida Flaishmans, PhD, OTRL, has over 20 years of experience in the field of pediatric occupational therapy, helping children and families navigate the important early stages of development. She's a person of real interest, not just because of her clinical expertise, but because of the way she connects, educates, and empowers both parents and professionals alike. With her deep understanding of sensory processing, early childhood development, and therapeutic strategies, Fraida has touched the lives of so many. We're excited to dive into her story, her insights, and lessons she has learned along the way. Fraida, welcome to The Inner Edge. We're so happy to have you here.
Okay. Well, today on The Inner Edge, we are joined by someone whose heart and hands have helped guide countless families. Fraida Flaishmans, a seasoned occupational therapist with over, I believe, 20 years of experience.
Actually, we're going to 30 at this point, right? Graduated in 1995, so it's almost 30 years, yeah.
So whether you are a seasoned occupational therapist or fellow therapist, a parent, and navigating supporting your children or other therapists, or just curious about the magic behind OT, this episode offers a front row seat to one of the most rewarding and human-centered careers out there. And so, we'll start from the top. So What first inspired you to become an occupational therapist?
That's a really good question, but I did want to tell the audience that we go back.
Yes.
Sometime from even before you were an OT.
That's right.
Right?
Yes.
So I'm wondering what inspired you?
Oh, wow. That's a great question. So I've always been drawn. So personally, the way it started for me was I was about 17 years old. I wasn't sure of which field of therapy to take. And I felt like if I volunteered, in the hospital and the nursing homes, and basically what I did was I saw what PTs did, I saw what speech therapists did. And when I went in to see what OTs did in the private clinic, I was mind blown because it was so broad.
Right, very versatile.
Mental health, hand therapy, geriatrics, pediatrics, and I felt like there was so many more options for me personally.
Sky's the limit.
Yeah,
as an OT. Yeah.
And also I felt like it was definitely more meaningful and purposeful. I think it just fascinated me that I'm able to help all ages, all areas, and I felt like I can enhance somebody's quality of life, and for me it was
a game changer.
Yeah.
That's what we got to do. That's how we have to live our lives, right? Helping others. Yeah. So I mean, I would say I really feel the same way. thinking about the future and career. I did want to be in the helping field. And I did feel that OT was broader. It wasn't so boxed in, there was a lot of possibilities. I was thinking that I would do adults, because I was going to be a mom and I wanted to have all the patience in the world for my kids. So I was going to do adults and then come home to my kids with all the patience. And I did do a little bit of hands for a while. I did a little bit of adult also rehab. At the end, it was the pediatrics that really spoke to me the most. And what I found was that the more time I spent with other people's kids, the more patience I had for my own kids. So it was actually the reverse. But yeah, I mean, the idea was to be in a helping profession and to be able to make a difference in people's lives. And OT was, I can't say like I'm not an artistic person, but I do think I'm a creative person. So it allowed for that expression. And I actually did it because I thought that it was a great career for a mom to do part-time because it's a very
Flexible.
flexible
Yeah.
career. And as crazy as that sounds, I don't think I've ever worked part-time. I've always worked full-time. I've had to work full-time, but I was able to change jobs depending on what stage in life I was in. So when my kids were really young, I did a lot of early intervention because then I could, if I miss a session, you could make up a session and things like that. So I definitely moved into different roles to have that flexibility, but I have always worked full time regardless. But I do think it's great. You have this profession where you can work as much as you want. You want to work overtime, you can work overtime too, right? So yeah, great. And I've just felt like it's always been the right choice for me.
I think that's what inspired me also when I was looking into the field. I was taking my courses, uh, you know, I think I was going for OT, and then I met you, and I remember sitting with you one weekend. A
We were
bunch.
upstate,
That's right. That's
right?
right.
In
Yeah, yeah, yeah.
upstate, right?
And
Yeah.
I think the collars introduced us,
Yeah, yeah,
and I remember you telling me how it was the best profession, and I felt good about it. I felt
yeah.
good about choosing the profession. You expressed, what you did and how you worked in pediatrics. I was at that point set on geriatrics
And
also,
hands. You were
and I was
interested in
doing enhanced.
hands? Yeah,
Yes,
yeah,
yes,
yeah, I
yes.
remember.
So when I moved to New Jersey in 2017, I told myself, I'm only doing geriatrics. I'll work for the nursing homes. And I'll never forget, I got a phone call from a Hasidic guy from Borough Park that called me up and said, Hi, Shalom Aleichem, Ephraim. I heard about you. You're an OT. I said, Yeah, but I'm not traveling into New York. I'm in Edison, New Jersey. And he said, Well, I'd love to meet you. I said, But I'm not interested in coming into New York. He goes, We have a need here for a male therapist. Please, can I just meet with you? I said, I'm sorry, but the truth is it's everything is shut down. It's 9 p.m. So I can't really meet you now. He goes, I'm willing to come and sit with you wherever.
Wow.
So he drove out from Borough Park
Wow.
and came to Dunkin' Donuts to sit with me and
Wow.
convinced me. So I said, how did you get my name, my number? And he said, somebody you went to school with that works for me.
Wow.
Made the connection, and
That's
then
great
the
story.
rest
And
was
then you
history.
ended up going to Brooklyn.
That's right. And
Sometimes we end up in places we
yeah,
don't expect. I could say that definitely is true.
yeah. And so how long have you been practicing occupational therapy? You've mentioned that it's been almost over 30
Yeah,
years.
I graduated. My graduation date was 1995,
Wow.
and
Wow.
it's
Wow.
2025. So
That's amazing. That's
here we
amazing.
are.
So can you share perhaps, I know you've worked in a few different places, Yaldeinu, Ichud, you had many roles. Perhaps you can share with the audience a client story that stayed with you,
Mhm.
something that you feel was meaningful, somebody who struggled or had a difficult time.
Yeah, I mean, there's a lot of stories,
Yeah.
that run through my mind. Um, I've done a lot of stuff. I even had private practice for a while.
Oh, I didn't know that.
I worked in schools. I had the DOE scholarship, so I actually
Wow.
started at the DOE, and then I was tried my a little bit with hand therapy and a little bit with adult rehab and working a lot of home care, adult home care, and then pediatric home care, early intervention. I did a lot of evaluations for early intervention for the Department of Ed. Um, it's been like so much, but the things that really stick out in my mind are, um, things that where the parents really wanted something, and whether it seemed impossible or not, where you like paired up with that parent and you said, let's try, let's do this
Yes.
together, so it seemed like, impossible. I'm thinking about a mom that I worked with, and against all odds, she just never gave up that her child would walk, and we would, doing that together. So I started out with her in early intervention, and working toward that goal that seemed insurmountable. Mom never gave up, all the practitioners working really hard. She walked. She might have been, I don't know, about 7, 8 years old before she took her first steps, but they never gave up on that.
Wow.
And, thinking like you sort of want to be you want to be realistic, right? You don't want the parents to have, unrealistic dreams, but you also want to be an optimist,
Right.
and you want to be a partner with them. And, however far you go, um, it's just like you're going to get somewhere. You're going to get somewhere amazing. So that, stories that stay with me are just the kinds of kids that weren't communicating and began communicating, weren't talking, and weren't walking and began walking,
Wow.
So you get to that point where that you're working with that child and they finally crawl, or, these kinds of things, and the relationships that you make with people over working like this together. And, just last week I was at a bar mitzvah. I actually went to the bar mitzvah, but it was kind of late. But for a child that I worked with in early intervention, and I hadn't worked with him, since he's 3 and turning bar mitzvah. So the relationships you forge with people, it's just like these unforgettable bonds, really.
Yes.
And everyone is kind of like, a different outcome and different successes, but that unbreakable connection that you have, because you literally fought a war together with another family, and you were, kind of there with them, whether it was the physical support, the emotional support, and then, just it's so amazing to be part of that kind of process. It's a privilege and it's an honor to be in a profession where you can be a part of that amazing outcome.
That's incredible.
Yeah, yeah.
That kind of, segues into my next question. How do you stay all these years not burnt out? You're doing so many different things.
Right.
You're a mom, you're a wife, you're working full time in so
Yeah.
many different settings in the pediatric world. How do you stay?
So now
Yeah.
I don't burn out because I am in so many different settings. So now my work is mostly consultative. And I'm jumping around and I'm in different places. I could be in Lakewood one day, I could be Queens one day, I'm in Brooklyn one day. Like, it's just so versatile. I'm meeting different people. I'm meeting different kinds of kids. I'm meeting privately with parents and, kind of coaching them on, what next steps for their kids. So meeting a lot of different people in a lot of different places. So there's no burnout.
Wow.
It's just more energizing and exciting. What I would say for therapists early in my career, when I didn't have that versatility, and then maybe that was like at risk for burnout, is well, two things, I guess, I'm thinking in my mind that keeps you from burning out. So the number one thing is that I never stop learning.
That's right. Yes.
So you keep on growing a new skill, learning a new technique, and not randomly. Like, it was always like, oh, I had this child with this problem, let me go learn about that. I had a child with that problem, let me go learn about that.
Wow.
Right? So always wanted to make sure I was bringing everything I could to whatever child was on my caseload. So that sort of was like the choice. Well, what am I going to learn now? What am I going to learn now? What am I going to learn now? Always learning around the new child. So there was always you could learn tons, but if you don't practice what you've learned, it goes away. So it was always learning and practicing. So searching for new and exciting ways to build my skill, help children in different ways. That's what kept me from burning out, because it was always different and it was always changing.
Wow.
So that was one way. Also, I guess, sort of like what that feeds into the next. Like, I never sort of felt like I have enough. I have enough information. I have enough skill, and whatever I have, that's what you get. It was sort of like, okay, I've got this case, and it's my responsibility now because I'm their OT. I'm the only one they've got. So I got to bring everything I have, but maybe there's more. Maybe
You're
there's
always going
something
out
else.
there
Going out to
searching.
get more, or collaborating, like pulling in, someone else. So wait a second, you know what? This child needs something else. Let me consult with somebody. Let me suggest to the mom that we do something a little bit different, and sort of like just really working it in its broader form. What happens then? You see change. You see progress. Like you're literally like pulling that child up with you, and then you start to see the fruits of your labor, and it's just you feel great. You feel great, and so it keeps you going like, wow, we really made a lot of progress. We really went somewhere. And wow, how do you burn out when you keep seeing these amazing things happening? Of course, sometimes you give it all you've got,
Right.
and the outcomes aren't always that great.
Right.
But you know what? You're you're partnering with that family. You're partnering with the team that was working with the child. There's always something positive. Maybe it wasn't the outcome you wanted,
Yes.
but we got somewhere. And that knowledge that I've brought everything I could, and there's always more. There's always more. I'm 30 years.
It's amazing.
And like I just found out about a new exciting course
Oh,
literally
yeah?
just today. I'm like super pumped, right?
That's
30
awesome.
years later.
Do you find the profession has shifted a lot the last 30 years?
Um, yes and no. That's a really great question. I'll tell you why. Now that I've been around for 30 years, I can tell you that everything kind of goes like in waves and fads. So things come and go. Like we're all doing, what do we want? We're looking for that magic
That's
solution,
right. That's
right?
right. Yeah.
What's that thing going to be that's going to
Yes.
fix everybody,
Yes.
And initially, when I started running from course to course, I did SIPIT training, sensory integration and praxis testing certification.
Mm.
Before I even graduated, I was already doing continuing ed. Like my thing
Wow.
was like, oh, sensory was going to, be the
You're a
cure for
course junkie.
everybody. So,
Yeah.
and it was hard, by the way. It was like a 4-part thing, and it
Wow.
was before tech. So I had to travel, like I was in Boston and Washington. And when you did your certification, you had to take the test in front of somebody who graded you on your performance. It was it's a standard, a very expensive standardized test. I had to like drive to like Boston and have somebody look at me give the test. It was crazy, like not like today. So at the end of the day, when you're like you're growing and you're learning and you're trying to like just learn everything that you can, you just keep on doing it. You never ever stop, and that is sort of like how you don't burn out and how you keep on how you keep being excited about everything. And look, this is like just amazing. Like I said today, I got excited about a new course that I'm hopefully going to take. Oh, if it goes through. So
Hopefully.
I'll tell you about it after.
Yeah, please.
Yeah.
So I like what you said about, if you don't use it, you lose it. So you constantly need to go out there and learn new things. And do you find that
Oh, you were saying about like I was saying that things, ebb and wane,
yeah,
and
yeah,
how things have changed. Yes, you get to be excited and go out there and keep learning because things are changing,
yeah,
and we have to grow with it. But I always have this saying, like, there's nothing new under the sun. Like, everything is the same stuff, like, really repackaged in
yeah,
a way, because the body doesn't change. We could be discovering a little bit more about how the body works, but it's really the same mechanism all along. I think that as these fads come and go, we sort of like get invested like that this one thing is going to be the solution.
right,
But that's not really the case most of the time, right? Most of the time, it's not one magic pill. It's a little bit, the right thing at the right time for the right diagnosis,
right.
and slowly working your way through a system. So it's a lot of hard work, a lot of patience, and going through this process with the child as they develop, instead of there being one magic
I
pill.
see.
And the fads come and go as if one magic pill is going to be the answer.
Right.
And it's the rare child, it could be that one thing is the answer, but most of the time it's a developmental process, and we have to work on all these things. What I can tell you about how things have changed, and this is I think I talk to other very experienced therapists. We used to see children that had CP, and we saw children with cognitive delays, and we didn't see the amount of autism that's out there now. We didn't see the amount of developmental delay that's out there now. So there's things happening. We're definitely, we need to continue to discover why autism is, so big. I work at a school now for 15, 16 years for children with autism. And I remember when my boss called me to offer me the job, I was like, I don't really work with kids on the spectrum. I'm really like more of a brain injury type of therapist. And so, but when we went in, and we learned everything we needed to know, that's like why you never burn out. Cause you're like, you put yourself in a new situation with new kids and you learn a new skill set and then you come out, to help. And so, I think that the developmental delay, on the other hand, has a lot to do with the fact that the babies are now sleeping on their backs. They're not getting tummy time. I mean, there shouldn't even be tummy time. Every baby should be on their stomach from day one when they're not sleeping. And they're not eating or digesting. They should be on their stomachs, right? So if you don't push up against gravity, you don't get strength, right? You're being stuck in these dunas. Even visually, you're stuck in one spot. So your visual system, your motor system. We have all kinds of apparatuses and swings and all kinds of devices. And babies don't even have to be on the floor anymore. And that's where they need to be. So then you end up with children that have subtle developmental delays and they're struggling in school now. Technology.
Oh, yeah.
Right? So we're not getting, you used to go outside and play. You come from school, you just played outside a whole day. Now kids are busy on technology. I don't even want to say what that's doing to the wiring of the brain with ADHD and all of that, but just physically, we're not out there on our bikes and our rollerblades and playing ball and running around. We're at home on devices, and it's really, really bad for the developing brain and for the body. So I think that's why we're seeing a lot of more typical kids that are struggling. So that's how it's changed. And I think that this population also needs more solutions. As opposed to you had a kid with a brain injury, a cerebral palsy or something, you knew like it was a lot of motor, physical and visual, but it was all muscular, it was all about the body. And now we have we kind of really have to be looking big picture, holistic, developmental concerns, individual differences, and really tackling things from the bottom up in a very developmental way.
Wow.
Yeah.
That was actually, I was going to bring two questions in one, but I feel like you answered one of them. The question was something to do with, like you've mentioned, there's so many different approaches and methods and fads. You have craniosacral, you have sensory integration, you have reflex integration.
Right.
Do you find you use all of them in different, I guess, when you're in different settings with different children, or do you find one works better than the other?
Right. No, that's the thing. Like you really need to know what's right for what child at what time of their developmental process. There's a place for all of these. Not necessarily for one child, right? But it's usually like a few things that are going to help this one child and a few things that are going to help that child. It has to be done at the right time. Thinking, let's say, like vision therapy, right? So important. But when there's a very weak core and a lot of reflexes and we see this more in younger children and they're not ready for vision therapy. So that's such a clear example of how other things we might not be ready for until we do the steps. And so, talking about specialties, right? It's really important to have these specialties. So when it's the right time for the child who has that right diagnosis, you need that specialty. But that message of that specialty should be, this is what's good right now for this, and there's going to be other things that are necessary along the way, because sometimes we're always hopeful, we wish, right, that one magic thing, one magic tool, and then the child's good to go, off and running. Just give you like an example. Let's say child's not reading, and then, all of a sudden everybody realizes, this happened to Ben Carson, by the way, who was a presidential nominee.
Yeah.
He was he was like a head of orthopedics at 37 years old in a hospital. But when he was in third grade, he couldn't read. And they found out that he just he couldn't see. A school nurse, and she got him glasses. Well, you know what? Glasses aren't going to make you read. They're going to help you see so you can learn how to read. And so we need to understand that all these things too with the specialties that they're going to get you to a place where you're ripe and ready
Mhm.
for other things. But then the other things have to happen, right? And they don't always happen naturally, right? So we sort of like recognize we have a road to travel. So wherever we're kind of going, we have to sort of recognize that we need to support families through the fact that it's a process, and usually not one magic bullet.
Yeah, and actually, how do you support or how do you approach working with families who may be overwhelmed or unsure with it could be different situations with what they're going through with their child, or perhaps, for example, their therapists. Like, for example, there's a therapist who's watching, saying, "Hey, I'm finishing OT school now, and I don't know what I should do. Should I be more specialty, like focus on one specialty, focus on learning many different things, and then choose?" I guess I asked you two different
Right, right.
questions.
No, but I can try to like bring it together a
Yeah,
little
yeah,
bit.
yeah. I meant to
And
ask.
it was like a little bit for you, but so you know, when we how we can our knowledge will
Yeah.
help us support families. So we'll talk about that
Okay.
secondly,
Yeah.
okay?
Yeah.
So what I would say is I think it's really important that somebody gets out there initially, has a lot of great mentors. By the way, the field has changed so much.
Yeah.
When I graduated, it was like we were just like, I don't know, we didn't know what we were doing, and we were just kind of like we had a few, things that we did when we went to the schools, and like was sort of like was also like an expectation, like you didn't have to be a great OT, you just had to come in and be a good OT.
Right.
Now we're demanding more from this
Yes.
profession. We're expecting more. We have more knowledge. We have more information. We have more ability to learn more. I
Mhm.
think, the internet helped with that. When I went to school, we had to go to the periodicals and like look up the journals and pull them off the shelves. Right here we have.
AI.
But it's like
Yeah.
it's amazing. Well, I don't even want to say AI because AI thinks for you.
Right.
So like I'm gonna go with like the just like when you can still think for yourself and access that information. I'm sure we can do wonderful things with AI too. But
Yeah.
like, whoa, like here we are. Like at the end of the day, we had less resources and we did less. Now we have many more resources and we're being asked to do a lot
Mhm.
more, which I think is amazing. But now what are we doing when the graduates graduate now? They're coming into this field where there's a much bigger expectation. And guess what they're doing? They're looking for mentors. They're looking to work in places where there are experienced therapists that can teach them. And that's amazing. Like that's just really, how the field has grown. The expectation is large. There's a lot of pressure, but there's resources for that. So, like I have people reaching out to me for mentorship.
Mentorship. Yeah.
And I
Yeah.
think that's great. But you know what? This idea that someone comes out, graduates, and says, "I want to make a difference. I want to
Yes.
bring the most that I can," and they're doing this on their own time, on their own budget, to be really great therapists, or they're looking for settings where they can learn from other people. So you're coming out, and I think that what you need to do is put yourself in that position where you're going to learn a skill set, where you're going to lay some strong foundation, when you're going to understand a lot of different things about the developmental process, different diagnoses and conditions, and then find your what speaks to you.
Mm. Understand.
Are you really good with your hands? Is this something that you want to do, like a Feldenkrais or a craniosacral,
Mhm.
a myofascial? What is that? Does that speak to you, right? Or does reflex integration speak to you? Are you more of like a kind of person that likes to, do like handwriting, or are you more physical? You want to heal with more like core work and cardio. Like what speaks to you? You take your knowledge, you learned, you came out, you had, supervisors, other therapists you collaborated with, you learned,
Mhm.
you worked with different kinds of kids and different populations. Now you decided I want to do what speaks to me professionally. And you go out there and you specialize. So then we need specialists, right?
Mhm.
But when the parent's going to come to you and you to evaluate and say, does my child need your specialty? Right?
Right.
Because say like if you have a hammer, everything's a nail,
Yeah.
right? So you have this broad focus where you can say, you know what, not every kid that's going to walk through my door is going to need my specialty. You can assess kids in a way and say, you know what, you'd be better off doing. You'd be, let's say, I do myofascial, and then you can say you'd be much better off with the core person, and sort of like you can move people along the right way, or you take on a client and you tell them, this is what I can do for you. When we're done, you're going to need X, Y, and Z.
So you're specific.
And so that's sort of like, telling a new grad. What am I going to tell a new grad? Have great supervisors. Put yourself in an environment where you're going to be able to learn from others. And then decide if you want to specialize, and then go for things that speaks to you professionally so you don't get burned out, right?
That's right. Yeah.
And then how do you help overwhelmed parents? You help overwhelmed parents by really, first of all, compassion, right? We're in this field because we're compassionate people. You wouldn't have chosen it if not.
Absolutely.
Really feel that parent, feel their struggle, understand what they've been going through. They're coming to you because maybe they've been pulled in 6 different directions. They need this therapy or that therapy or that therapy. Maybe because they've tried a lot of things and they're disappointed in the results. Maybe they've tried some things they're excited about what happened and they want more. Maybe they're new and they don't know. All of a sudden their child went to school and they don't realize how challenged their child was until they were with a bunch of other children their age, and they don't know what to do. But either way, you can support the parent first by listening to them, hearing them, understanding what's the struggle, what are they struggling with, why is it so difficult for them, what do they want, and then you can offer them this is what I could do for you, this is what this could do for you, these are your options out here. Maybe discussing about schools or different approaches, or kind of like this, it's on us to know more, to help them. And if we can't, that's okay. We can't know everything.
That's true.
Right?
That is true.
So, but we maybe can know someone who can help them, someone who will help them, someone who can't. So have resources to refer out, but you come with compassion, and you just,
It's beautiful.
Yeah. I mean, I have one parent, I got a message from a parent that it wasn't what I did with her child that helped her so much. It's how I helped her understand her child's challenges. That was what she'll always kind of remember about our connection. It's so fleeting, like 30 years, how many kids I've met, parents I've met, like little snippets of time in their life. And I got lucky enough to be in that moment with you at that time. And then everything is like a different, you're in a different place at a different time, but you bring what you can in that moment for that parent. And that requires sometimes a lot of resources.
Yes.
And if you don't have the resources, that's okay. But refer out. If you think a kid's going to benefit from aquatic therapy, that this is what the child really needs, and you're not an aquatic therapist and you don't have a pool, so you tell the parent, right? I think this is going to be really great for your child. Let's try to find someone, right?
That's amazing.
And it's just such a tangible, obvious, thing. But we don't always think beyond our 30 minutes.
Yeah.
Which I think we need to, because the parents really need our help.
I love how you're in so many different areas. You don't see so many OTs today, at least. I don't know anybody else except yourself who knows how to, apply aquatherapy, reflex integration.
Right.
Now you know how to do cranio.
Right.
You in all areas, I feel like you have mastered it.
Well, I wouldn't say that I mastered every area.
I
But I
feel like
have
you
definitely endeavored to go out there and learn about every area. Do what I can personally, and then at least have enough information to support parents in making decisions and referring to good people,
Yes.
various things. So, but it's a long time coming, right? We're talking about 30 years of, going and learning and searching and collaborating, really important. The relationships that I have with other therapists that have specialties that we can, connect on is really, really important. We talk about, even if it's even not in my field, I have PTs that I recommend to, developmental optometrists that I recommend to, and we can have our dialogues back and forth. I think this is going on. Can you take a look at this? And, even beyond what I'm capable of, right? But learn and grow all the time. And the human body is so interesting, complicated, and intricate. Even how someone's engagement and ability to connect socially with others, anxiety, social emotional challenges. Every single child that's struggling with something,
Right.
how do they feel about themselves, right? And so we need to understand that emotional piece too. So there's so many layers here, and we have to grow with our varied, diagnoses, the various children, and we just kind of just keep on growing. And I mean, I can't even imagine that. Like I've been working more years than I'm going to be working
Wow.
because there's so much more still to do and learn,
That's
right?
incredible. Yes.
Yeah,
Can you share, you mentioned that you had a private practice at one point.
yeah.
Can you share a little bit about how that was
Oh, yeah.
and what happened and maybe something that you've learned from it? I know,
Yeah,
did
I
you
mean,
have,
so
yeah.
that's a really big question. As I want to say, so first of all, I started out working. One of the things I did the first few years that I worked was worked in a lot of different settings and tried to learn a lot of different things. I was thinking in my mind that I would open a private practice. The reason why I opened a private practice was because I wanted to do aquatic therapy. That was my love. I talk about like everyone like speaking toward what you want, like to do.
Yeah.
So I was a lifeguard before
Mm,
I was an OT. I love the water and what it can do for children. And at the time, I was working with a lot of brain injured children, a lot of cerebral palsy, non-ambulatory kids. So aquatic environment was, certainly like that's the place to be. And I really wanted to work in a pool. But if you live in Brooklyn, really not that many pool options,
no.
right? So I decided to open up a small private practice with a swimming pool. And it was a building with space, a 3-floor building, and I was gonna have my pool on one floor and do some therapy there, and rent out the other parts as medical office space, right? The second we opened up the doors, there were so many people that wanted to get in. The place grew like crazy, and it ended up being a full rehab facility.
Wow.
And it sort of like it was a snowball effect where this snowball kept growing, and I certainly financially couldn't keep up with it. So I had to get out. But um, it was an amazing experience. Again, I got to meet so many people, so many different diagnoses, right? I had this one woman, she was an elderly woman. She insisted that I work with her. She only wanted the director of the place because she said she had a very delicate skin and that she'd been burnt in the past with hot packs, and she only trusted the director. She didn't know me. It's not like she trusted me, but first she assumed, I guess, the director would know what they were doing, right?
Right.
So I did work with her. She was a beautiful elderly woman, and she did have the most delicate skin I've ever seen. Like literally a hot pack for like a minute or two could really, like her skin was like, so you really had to be very careful. But she was in so much pain. So that's the only thing that helped her.
Wow.
So we're,
Wow.
you're having all these varying experiences and, this, place. But the one thing when I decided to segue out, and that's its own complicated story, we could have a whole podcast about that. When I decided to kind of segue out, which took me a few years to get out, but
Wow.
um, at the end of the day, the one thing I could say was that I felt um, like a huge burden had been taken off of my back
Mm,
when I left. I felt a responsibility to every person that walked through that door.
wow.
And when we work as independent contractors, so I'm responsible for every kid on my caseload and their families, like that's one. But when you work as a boss and you're hiring OTs, PTs, speech therapists, and working for you,
It's a lot of
and you
responsibility.
have this passion
Mhm.
to really, really help people, and you're feeling like all of their caseload is your caseload, that's too much, too
Wow.
much. And sort of like when I left, I never turned back.
Wow.
And it was a luxury for me to now to be able to like just work with my kids,
That's the reason why I asked that
Yeah,
question, because I feel a lot of people go into the field thinking one day I'll learn enough so I can open up my own practice, be a director in a specific niche, and but it's not as simple
yeah,
as it's a lot of responsibility.
yeah,
Yeah,
yeah.
it takes a lot. Um, Did we discuss advice? Any advice you'd give for
But
anyone
I mean,
entering?
we talked a
A
little
little
bit
bit,
about new
yeah.
therapists, but my advice to new therapists would be, similar, along lines that I would say, um, first of all, good for you for doing, what you did, and feel very proud, for picking this kind of profession, especially now when, like, I don't know, like, everybody's into like different types of work nowadays, with tech and
Yeah.
online things. And so, sticking with the human profession. Wow, good for you. You will feel awesome. You will feel great about your choice, and good for you. But yeah, when you're new, find people to work with that you can learn from. Be open to, all, ideas. I'd say, half of the things I learned like sort of, I don't want to say on a whim, but like without thinking too much about it. No, yes, I will travel there and take that course. Yes, I will go and treat that interesting case, that you're, putting towards me. Like, let me try. I want to do something new. I want to do something different. So be open to new experiences. Don't close yourself in, um, and just if you really want to feel great about your choice, then, you know, really do whatever you can to bring as much to the table as you can, when you're there. And yeah, I mean, at the end, I always say, like, we don't realize that, you know, as OTs, we see with our children, right?
Yes.
We have so much knowledge about child development and, like, things to, consider, things are healthy or not healthy for our kids. We learned it professionally. We learned it in the work that we do. We have so much knowledge that other people don't have. But we take it for granted because we think like everybody knows everything that we know, right?
Right.
So a lot of times, your child comes to you for your session. We don't realize that the parents really are looking to you for guidance and not just support, emotional support. We're going to, be there, we'll help you, and we're going to, do whatever we can to help your child. But also they think that you're going to tell them everything that they need to know. And we think they know everything. They're just coming to us for a little bit, right? So try to be as helpful as you can to families and really like understand what they need to help their child, not just how you can have one great session, but how you can sort of like recognize the bigger picture and help support the parents through this process.
Process.
Yeah.
Beautiful. If someone, whoever's listening, and they're not sure, they're looking at different professions, they want OT, but they're not sure, they're on the fence a little bit, what would you tell them? Anything specific that
I
you'd
would,
say?
tell them like kind of like what's your other, what are we comparing this to? Like, what are
Ah,
your other options? Like, what do you want? And what brought you to a place where you wanted to be an OT to begin with, right? Where, and if the desire that you had initially to be an OT is still there and it can be answered through
mm,
this profession, then go for it, So of course we have to compare. But if you really do want to be in a profession where you can help others, um, like I never looked back. I felt lucky. It's almost like I'm not even sure how I ended up being an OT. It just happened somehow, and I felt I was almost guided into this in some way. And if you've been guided to this place, that it could be the right thing for you. Are
absolutely.
you, what is your personality? Do you want to help others? Do you want to give to the community? Do you want to, what really what the other options are for you, right? If
Absolutely.
you're, or sometimes you can bring that with you. So let's say you're an artist, right? Really, you're thinking like maybe I should go
Mm,
to art school or, that kind of thing, or should I be an OT? Well, look, right? You can do that. You can bring your artwork and help people through that, like whether it's in the mental health
yeah,
field or through occupation.
yeah,
You can sometimes bring the other things that you want to help you and feel gratified that you kind of like because we're such a versatile like profession, like OT is everything, right?
absolutely.
OT is everything. We
Yes.
we anybody struggling with the inability to do something that they need to do or would like to do, their occupation, we are going to look for those solutions to help you. And maybe it's your other desire that you have
Mm,
that you're thinking maybe I shouldn't do OT that you can bring to the table.
okay.
So you never know. You can.
That brings me to my last question. we mentioned AI. We know that we're living in that age now.
Yeah.
Do you find that AI is going to somehow connect with OTs or
Right.
be impacted by OT or vice versa?
I've thought about that in terms of like everyone's in a panic now, right?
Yeah.
How is AI going to take over people's jobs,
Yeah.
right? So we're thinking about that. You know, we're hoping it's going to enhance our
Mhm.
jobs, right? But how is AI going to take over some jobs? And I think that there are certain professions that need to worry about that, right?
Yes.
But because what we do is so hands-on and it's not like you can just you list some symptoms and then you get an AI spits out a diagnosis for you, right?
Right.
It's the work that you need to do with a child to connect with them, recognize the subtle things that the individual differences about them, the way that they need to be helped. This child needs to be helped with very direct instructions and visuals. And this child needs to be helped by mirroring what you are doing, right? This child needs to be helped by some more hand over hand. And you only know that individual difference because you're there with them in the moment and you're connecting with them and you're recognizing that. You can't do that with AI.
Right.
And maybe I'm naive because I don't understand enough about AI and who knows what's going to happen in the
Right.
future with AI, but it just doesn't seem to be possible. When you're looking at a child and the way that they're doing things with their body, you're giving them a new body mechanic, way of doing things, or you're giving them solutions, or even, I was talking about therapeutic use of self. Like, I was working with a child today who was very hyper, and she was all over the place. She was running in and out of the treatment room when it wasn't her turn. And I was showing her therapist how to do a good sensory diet with her. And we ended with some deep pressure massage. And it wasn't just the massage. As my tone of voice changed, right? And I started to talk to her about a little girl that had the same name as her as we're doing the massage and what she was doing that day. And my therapeutic use of self, the way I breathed and the way I spoke as I'm giving her the massage, brought her to an extremely calm place, right? So how are you doing that with AI? The next kid that would come in, I would change my tone of voice and we'd be doing something totally different. And even if I was giving her a massage, I might be talking to her in a different tone of voice too. It depends on. So that intuitiveness,
The human experience.
it's just,
Yeah.
I'm not worried about
Okay, good.
AI coming in and taking over our profession. And if that were to be the case, then it would be a sad day for OT
Yes.
because we would lose that. Right. And this, talking about a lot of online, this Zoom therapy.
Yeah, the Zoom therapy.
There is a place there, for that when you have nothing else, there's some during Corona, during Corona, I helped a kid learn how to read.
Really?
On
On
Zoom.
Zoom?
On Zoom.
Wow.
And yeah, so it's possible, right? And with his individual differences, he had dyspraxia. He was a good sight reader. And I was able to recognize, to kind of harness the opportunity to use a lot of sight things, visuals, to help him with reading. That was his gift.
That's amazing.
Right. So, but, we had that opportunity. I obviously knew him before, so I knew what he would do well with on Zoom.
Right.
So there was, of course, that human piece. So, but it's not that it's not. Nothing can happen. Plenty can happen on Zoom, right?
But you're more limited.
But yeah, you're definitely putting yourself a little bit in a hole, and you don't have that absolute connection. Yeah.
What are you most excited about in the terms of the future for occupational therapy?
It's a little bit like I touched on earlier, that we are we have access to more info. We are doing more things professionally. It's sort of like, every single year we're getting deeper and deeper in understanding of how the brain works and how the body works. And we have this technique and that technique and more ideas of ways to help people. And the graduates that are coming out now and they have all these amazing therapists to learn from. They're coming out and there's an expectation of performance. and they're coming out strong. They're coming out with this strong idea that, like, wow, I have so much I need to do. And the fact that um there is that ability to be looking at all these therapists that are specializing in things, that have deeper understanding, they're learning from these supervisors, mentors, consultants, and it's sort of like, I can, like, imagine to myself, like, what it would be like to to know what I know and be a starting therapist. Like, I'm thinking back my first, years of working. Like, I mean, I hope I did a good job, I hope I
Absolutely.
did a good
I
job, but,
think
like,
so.
wow, like, how much didn't I know then? Well, the therapists coming in now are coming in with a lot more knowledge than we had 30 and 40, 40, 30 years ago as new therapists. So, I think that's what I'm excited about. I'm excited about seeing what the newer therapists that are learning now from these amazing mentors and people who have been in the field for a while, what they're going to look like in 30 years.
Wow.
Like, could you imagine what the profession's going to be? If you're starting out so strong, and
Can
then,
imagine.
like, you're just growing from the wow, like,
Yeah.
it's, there was so much, like, sweat, blood, and tears, and efforts and energies that went into, like, knowing what I know 30 years later. And I'm gladly giving that information over to all the new therapists. So you should know all of this stuff, right? And now,
100 years, right?
yeah,
Our
I want
profession is 100 years old.
yeah,
I
it's like,
believe it
so
just,
it's
yeah.
new. So, like, I'm thinking to myself, like, wow, what are these, these therapists that I've mentored and supervised, that I poured this knowledge into, they're coming in so much stronger than I ever was at their stage. What are they gonna look like
It's
in the
amazing.
future? That is exciting to me.
I'll finish off with this. I love the fact that you are such a sharer of information. I don't find a lot of people are very easy to share intervention, treatment, evaluations. You give and you mentor so easily, and I really appreciate that.
It's like,
It's right. It's a gift.
it's time to
Yeah.
give it back, right?
Yes.
It's like, yeah.
Thank you so much.
Oh,
Thank you for
thank you
making
for
this time. Of
inviting me. It's
course.
nice to see you again.
You too. It's been a
Yeah.
pleasure.
Yeah, thank you.
Thank you. Today's episode is powered by the Brain Links method. Because let's be real, your child's not lazy, defiant, or allergic to problem solving. Their brain just needs a little rewiring, and maybe yours too. Brain Links is the method that takes kids from I can't focus to I've got this. With zero judgment and a whole lot of fun. It's like a therapy met a jungle gym and decided to change lives. Want to know more? Dial 917-201-8425. Again, 917-201-8425. Or email brainlinksmethod@gmail.com. Again, that's brainlinksmethod@gmail.com. And tell them you heard about it on our podcast. Your child's brain is brilliant. Let's help them shine.